So what are radiographers responsible for? Radiographers are responsible for producing high quality medical images that are used to assist physicians in diagnosis and monitoring of a patient's illness or injury. Radiographers produce these diagnostic images through the use of X-rays, CT, ultrasound, and MRI. In hospitals, radiographers work within the imaging department as well as other areas of the hospital, such as theatre, ICU, emergency department, and cardiac cath labs. Radiographers work with an array of machines such as mobile machines in the ward, CT, and MRI machines. Radiographers also work with doctors, nurses, and people with different disciplinaries and specialties, such as physiotherapists. Radiographers work with these healthcare professionals to form multidisciplinary teams in order to provide patients with the best care possible. In order to become a radiographer in Australia, you must complete a degree in medical radiation science that is accredited by the Australian Society of Medical Imaging and Radiation Therapy, which is typically an undergraduate degree or master's. Physiotherapists are experts in the structure of the human body and its movement. They work to improve and prevent a broad range of physical problems associated with different systems in the body. Thus, they are involved in assessing, diagnosing, planning, and managing the care of patients across a broad range of areas with musculoskeletal, cardiothoracic, and neurological problems. Physiotherapists can be seen working in a variety of different settings, such as hospitals, rehabilitation centers, sport clinics, and many more settings. In the hospital, physiotherapists can work in partnership with nurses, doctors, and radiographers to form multidisciplinary teams in order to diagnose and treat the patient's illness or injury. In order to become a physiotherapist in Australia, you must complete a degree in physiotherapy, which is typically an undergraduate degree or master's. There are many different types of nurses, but registered nurses are responsible for a number of things, which include observing and recording patient behavior, performing some diagnostic tests, administering medication, and establishing treatment plans. They are also required to prep patients for examinations, assist in operations and post-operative care, update and maintain medical records, and help in treatment in medical emergencies. Registered nurses work alongside people with different specialties and disciplines, such as doctors, surgeons, radiographers, and physiotherapists. They work with these healthcare professionals to form multidisciplinary teams in order to provide patients with the best care possible. In order to become a registered nurse in Australia, you must complete a degree in nursing, which is typically an undergraduate degree or master's.